Our last big presenter today is Dr. Stunkel, who is from the Department of Ophthalmology, and I've asked her to talk about visual changes and cognitive dysfunction or brain dysfunction. Because people, we learned earlier last year that hearing loss affects your brain. Today you heard about how gum disease affects your brain. Now you need to learn something about what the eyes do for you. Dr. Stunkel.
Okay. Hi, I'm Dr. Stunkel. I'm one of the fellows at the Emory Eye Clinic, and I'm also a neurologist. So I am going to talk a little bit about the connection between the eyes and the brain. And before going into that, I'm going to talk a little bit about the normal changes that everybody experiences as they age related to their vision. So first I'll talk a little bit about the normal changes, then I will talk about the changes that can be related to problems in the brain, and then I'm going to talk about what you can do to keep your eyes healthy at whatever age you're at. So there are three major things that almost everybody is going to experience related to their eyes, and I'm going to go through those. Those are presbyopia, cataracts, and dry eye syndrome. So presbyopia is the normal loss of your ability to focus on objects at near that happens as you age. And in fact, presbyopia literally means aging eyes, and this is something that's going to happen to everybody who gets old enough. So in order to focus on something up close, like reading the newspaper, the lens in your eye actually has to bend so that you can focus on that near object. However, as we get older, it becomes more difficult for your eyes to do that, and that's for a couple of reasons. For one thing, as we age, the lens actually gets stiffer and it gets more difficult for it to bend. And for another thing, the fibers that do the bending get weaker. So you're kind of getting a problem from both sides. You're getting a stiffer lens that's harder to bend, and the fibers that are doing the bending are getting weaker. So some of the things that people notice as this change comes on, it's difficult for them to see things close up. They may notice problems with reading fine print. You may see people holding the newspaper at arm's length since they can't see it as well when it's closer to them. And people may notice that they're having headaches or eye strain from the attempting to focus on something close up as it gets more difficult. And the treatment for this is reading glasses. So basically you need to get a lens that's going to do the job that your lens can no longer do. And so what we see is around the age of 40, this is when you start to notice this problem, and then through around the age of 60, it gets slowly worse and worse. And around 60, it tends to even out, and your lens is about as stiff as it's going to get, and usually your reading glass prescription doesn't change that much after that time. Another change that everyone who gets old enough is going to experience is cataracts. So in addition to getting stiffer as we age, the lens also gets more discolored over time. And so this is actually a normal part of aging. And as you can see, I have some pictures up there that show lenses getting more discolored at different ages. And so it's important to remember everyone will eventually get cataracts. Some people get them younger than others, but it is actually something that happens to everyone. Some of the symptoms that people may notice as they get cataracts is their vision gets more blurry, and they'll notice that both up close and far away. They may notice glare around lights, and they may notice it's really hard to see at night, and their color vision can get affected because as the lens gets discolored, it affects your ability to see colors. And then it can also actually cause you to become more nearsighted over time just because of the changes that the lens is experiencing. And so Monet is someone who kind of gave us a great picture of what it's like to get cataracts because he lived back before cataract surgery was common, and as he got older, his paintings got more blurry and they started to take on a more yellowish, brownish color because he was looking through cataracts. And the treatment for cataracts is to surgically remove the lens and put in an artificial lens so that you'll get rid of the discolored lens you're looking through, And then we have all kinds of different artificial lenses these days that can replace that lens that's no longer working for you. And a third thing that I think we talk about a little bit less is dry eye syndrome. But it's unfortunate because it's just as common as the others. So the front of your eyes is supposed to be covered with a tear film. And the tear film is more complicated than you would think because it has three major components. It has a watery component and an oil component, and it also has a mucus component. And disrupting any of those three components can start to cause problems with the way that your tears are working. So that's why some people may actually notice their eyes are watering a lot even though they feel really dry. That may be a problem with the oil component or the mucus component of their tears. And so some of the symptoms that you may notice if your eyes are dry is to have either a burning sensation, a stinging sensation, or even a feeling like scratchiness or feeling like there is something in your eye when there isn't actually anything there. Sometimes people don't really notice the burning or stinging, but they may feel like by the end of the day or after reading a long time, their eyes get really tired. And that feeling of tiredness is often a sign that your eyes are dry. People also may notice sensitivity to light with the dryness, and if it's getting bad enough, you may actually see red eyes because of the dryness. And sometimes it can also affect the surface of the eye in that people may notice blurred vision or double vision. And one of the things that can clue us in that this might be dry eye related double vision is if it gets better with blinking or better with resting your eyes. So dry eye syndrome is actually common at any age, but it gets more common as you get older, and it's also more common in women than in men. And some of the reasons that it's so common is that we're all looking at our iPhones all day, and when you're looking at a screen, you're actually only blinking about half as often as you would blink if you were going about your day doing other things. So as you're looking at the computer, you're looking at the iPhone, or reading, you're actually blinking less frequently, and that can cause your eye surface to dry out. Having had eye surgery in the past can also be disruptive to the tear film of the eye. LASIK surgery, cataract surgery, all those can make dry eyes more common. And then just like we learned about in the dental health talk, a lot of medications that we take as we age can actually cause dryness of the eye surface as well, in addition to the dryness in the mouth. Also, especially in Atlanta here, where we're always using the air conditioner, we can have really dry indoor environments, which can contribute to dry eye. Allergies can contribute. And then if you have other diseases, autoimmune diseases like rheumatoid arthritis and other diseases like Sjogren's disease, those can cause increased risk of dry eye. And Parkinson's disease can also cause dry eye. And part of that is because patients with Parkinson's, they're slowing down in every aspect, and one of the ways they slow down is also in their blink. So Parkinson's patients blink less frequently and thus can get dry eye symptoms. So a lot of the remedies for dry eye are actually things you can do at home, and I'll also say I'm not sponsored by Cysteine. That was just one of the artificial tear brands, but you can get artificial tears. They're available over the counter. We usually recommend that you get the kind that come in the little vials like in the picture, because those have no preservatives, and sometimes people can have their eyes irritated by the preservatives in the big bottles. We also recommend that you take blink breaks while you're using your iPhone or using the computer, just to make sure you keep your eyes hydrated with the tears. And you can also use warm compresses on your eyes if they're feeling dry or tired. That can stimulate the oil production to make the tears higher quality. And wearing sunglasses outdoors is a good way to protect your eye, both from UV rays and also from wind. And then stay hydrated. So we already have heard that it's trendy to have a water bottle, so here's another reason to do it. And you can use a humidifier if you're in a particularly dry environment. And some people find that fish oil supplements help too, because that can help you to have more healthy oil component to your tears. So all of those are things you can actually try completely at home if you're having dry eyes. And then if those aren't enough, then your eye doctor can actually talk to you about more advanced treatments for dry eye. So now that we've talked a little bit about normal changes that most of us can expect to experience, I'm also going to talk about the vision changes that may be related to brain disease, so that we can understand a little bit about what those symptoms look like and what we can do. So it's important to understand that the eyes are only one part of the visual system. Your brain has to get the images from your eyes, and it has to interpret them. Otherwise, you're not actually getting any useful information from your eyes. So that means that even if you have healthy eyes that are working perfectly, if your brain's not working, you're not going to be able to see. And some of the time when somebody has these vision changes related to their brain, it's actually kind of hard to pin down because they may have trouble describing it. And there's a couple of reasons for that. One of the reasons is that the fact that they have a brain disease often might be affecting other parts of their brain, like their memory or their language. They may not remember their symptoms that well, or they may remember them but not be able to put them into words very well. But even in addition to that, the symptoms that can come from your brain are a lot of times strange and kind of hard to put words to and hard to describe. So it can be hard for people to tell us exactly what's going on. And for that reason, sometimes my antenna is raised in the clinic if somebody comes in and just says, I can't see or I can't read, but they're not really able to give me a better idea. They're not able to say, oh, this is blurry vision. Oh, I'm missing a part of my vision. They're like, I don't know, it's just something's wrong, I can't see. So I'm going to talk about two of the ways that we'll see these vision problems coming from the brain come about. So first I'm going to talk about problems that come from one specific location in the brain at a time, because that's a little bit easier to wrap our heads around. So this is a picture of a visual field, meaning that if you've ever been to the eye doctor and they show you all kinds of blinking lights and you're supposed to click whether you can see them, this shows us what the patient is able to see. And this person is missing the right half of their visual field in both eyes. So they're able to see everything out on the left side of them in both their left eye and their right eye. And in both their left eye and their right eye, they're not able to see toward the right. And this is because, as you may have learned at some point, the left side of the body is controlled by the right side of the brain, and the right side of the body is controlled by the left side of the brain. This also extends to vision. So everything that I'm seeing out on the right side is interpreted by the left side of my brain, and everything I see out on the left is interpreted by the right side of my brain. And so for that reason, if you have, for example, a stroke or some sort of problem, like in this picture, affecting the left side of the visual part of the brain, then it's going to cause you not to be able to see in the right side in both eyes. And we commonly see this as a result of stroke, but it can actually happen from anything that affects that location of the brain. It doesn't have to be a stroke. Another problem that comes from a specific location in the brain is something we call neglect. And this is referring to our ability to pay attention to the whole world. So when somebody has a problem on the right side of their brain, they have trouble paying attention to the left half of the world. And that's because for most of us, the left side of the brain is dominant. So most of you are probably right-handed. Right-handed people have the left side of the brain dominant. And left-handed people actually still usually have the left side of the brain dominant, but some of them have the right side of the brain dominant. So if you have a problem in the non-dominant part of your brain, then the dominant portion of the brain just kind of takes over and ignores the other side of the world. And so this picture of a clock is somebody who had neglect. When they try to draw the clock, they're only really paying attention to the right side of the world. So they drew a clock, but then they just tried to fit all the numbers on the clock onto the right side. And so this can affect your sensation, it can affect what you're doing when you're trying to move around, it can also affect your vision. So you may technically be able to see both sides of the visual world, but since the right side of the brain isn't paying attention, you don't really see the left side of the world, and you only really notice the right side of the world. And this is also usually caused by a stroke, but it can be caused by any problem in the brain in that location. So now that we've talked a little bit about specific locations in the brain, I'm going to talk about some of the problems that we can see that come from the ability of different locations in the brain to talk to each other. Because our brain has lots of different pieces doing lots of different things, but it really needs to be able to organize everything and have the whole brain work together to be able to get the information that you need. So when you're looking at the world, you're actually seeing multiple images over time, and you're integrating them together to see things moving and see how things relate to each other and where things are in space. And you're also paying attention to the things that you need to pay attention to. You're ignoring, the gray walls and you're looking at a person, or you're looking at what you're reading and you're ignoring all other kinds of visual information that you see. And that's an important part of how the brain's able to see well as well. So Alzheimer's disease actually affects the connections among different parts of the brain. And so we're going to see how that can cause problems with the vision. And just keep in mind when we're talking about this, that this can happen to somebody with normal, healthy eyes, but they can still have all these visual problems because of the problem with their brain processing the information they're getting. So simultagnosia is a situation in which you're able to see all right, but your brain's not really able to pay attention to the important things, and thus it can't really make sense of what it's seeing. And so here's an example. This is a color plate that we use to test people's color vision. Most people can see that there's a green 5 on an orangish reddish background, and we're usually using this test to see if people can see the colors. But somebody with simultagnosia may be able to see that there are green dots and see that there are orange and red dots, but they can't actually make sense of the picture and use their attention correctly to see that those green dots are making up a 5. Another example is here we have a test that we use for simultagnosia. All these little t's are making up a large H, but someone with simultagnosia will see lots of little t's and they won't be able to see what the main picture is that they're making up. Or this is another picture we sometimes use in clinic. It shows a scene of a family in the kitchen. Most of us can kind of take in the whole scene as a whole, but patients with simultagnosia may see a shoe and a plate and a cookie, and they may be able to go and tell you all these different things that you're seeing, but never really come up with what's going on in the picture or see that it's probably taking place in a kitchen. And I had a patient who described this to me as saying, it feels like objects are popping in and out of sight, because as his attention was able to see an object, he would see it and then it would be gone, and he couldn't direct his attention in order to see what he wanted to see. Prosopagnosia is the inability to see a face despite having normal vision. And this is similar to simultagnosia in that it's not a problem with the vision. You're seeing all the parts of the face, but your brain's not really able to put the picture together and understand that a face is what this is composing. And so patients may notice that they're having to, or family members may notice that they're recognizing people more by their voice or by some sort of characteristic like a hat they always wear, but they're not really able to recognize people by their face anymore. Or another example is we can see that this picture of a bunch of vegetables looks like it's making a face. Someone with prosopagnosia may be able to see the vegetables but can't really see the face that it's composing. And one way we can test for this is to show people famous faces in the clinic and see if they're able to recognize who those people are. Visual object agnosia is in the same line. You may be able to have normal vision, but not really be able to recognize what an object is when you look at it. So one way we can test for this is to show you an object in clinic, for example, a paperclip or a pen, and see if you can name it. And then if you can't, you may be able to, and we hand it to you and you can name it then, we know that there's a problem in the visual processing. And there was actually a very famous case of this that was described by Oliver Sacks, who's a neurologist who also is famous for writing a lot of books about neurology. His most famous book was The Man Who Mistook His Wife for a Hat. And the title character was actually a man who had visual object agnosia. He was standing next to his wife, and he thought that it was the coat rack with a hat on top, which I'm sure his wife did not appreciate. Topograph-agnosia is kind of getting into the visuospatial realm. It's the inability to navigate familiar surroundings, and this is really common in patients who have Alzheimer's disease. Because of the visual and spatial processing, even somewhere that they should know how to get around, they may get lost. In extreme cases, may even get lost in their own house. And then akinetopsia is also called motion blindness, and this is involved in being able to put those pictures together that you see over time. Instead of seeing multiple images as movement, you may just see multiple snapshots and not be able to see them as movement. And people have described that flowing water may look frozen if they have this condition, like successive snapshots of frozen water. So how do we tell when somebody has visual problems from their brain rather than from their eyes? So there are a couple ways that we tell. We may have already our antenna up if somebody has risk factors for having a brain problem. If they have risk factors for stroke, or if they've had strokes, or if they have dementia or symptoms that may concern us for dementia. But the other way that kind of clues us in is when somebody's visual symptoms are really not explained by their eye exam. So their vision is really bad, but when we actually look at their eyes, everything's looking pretty healthy. And then, as I said before, one of the things that can clue me in is if somebody says they can't see or they can't read, but they're not really able to explain why they can't see or what their exact symptoms are. Because most people who have blurry vision or some sort of missing vision or double vision can say it that way. But patients with these conditions often just say, I can't see, and they can't really say anything more detailed about why. Another thing that starts to clue me in, these are some of our residents at Emory who are demonstrating the way not to use the pinhole occluder. So when we have people look through this, most people can get oriented to the fact that they're supposed to put the nose piece over their nose and look through with one eye. Patients who have visual spatial problems have a really hard time figuring this out even after you explain it to them. So they may be sticking it over the wrong eye, keeping one eye covered, or covering both eyes, and basically they have trouble because they're having problems orienting themselves visuospatially. And then another thing that can clue us in is there's a lot of information on the eye chart here, and if you have brain problems, it can be hard to know what to pay attention to. So if you're doing really poorly at the eye chart, and then when I start showing you one letter at a time, suddenly your vision's a lot better, this is starting to be a clue that it might be a brain problem. And then, as I talked about before in the earlier example of simultagnosia, if somebody can't read this color plate, but they're able to tell me that's green and that's orange, there's some disconnect there. Because if you can see the colors, you should be able to see the number up there. And then finally, when somebody talks about this, when somebody is shown this scene, if they start telling me that there's a cookie and there's a shoe and there's a hand, but they can't even tell me that it's taking place in a kitchen, that's a clue for me that it might be a processing problem. And then this other example I showed of if they say there's all these little T's and they can't tell me what this shape is that the T's are composing. And then drawing a clock is also a really good test of us that we use for visuospatial dysfunction. So this is the common clock that people draw if they have neglect. And then these are some real examples of clocks that people have drawn in the clinic recently who had visual spatial processing problems. So in this clock, the numbers didn't make it onto the face. In this clock, they ran out of space and just started putting numbers other places. And this clock is also, they got all the numbers on there, but it's not all, some of the numbers are repeated and they're not really where they're supposed to be. So these are things that can tell us about how somebody's able to visuospatially process. So I think one key point to take away from this is that somebody who has brain disease affecting their vision may have really poor vision even if they have totally healthy and normal eyes. And while there's no treatment specifically for these visual processing problems, there are a lot of ways to help the person navigate better. And one of the things is to use, instead of wearing bifocals or progressives, if somebody starts to have visual processing problems, we advise them to use large frame, single vision glasses. And that's because if you're having trouble orienting your eyes to where they're supposed to be and paying attention to where you're supposed to be, it's hard to get your eyes exactly where they're supposed to be for the near vision and the bifocal and then the far vision. It's actually a lot to ask. So you can use large frame glasses of one type of prescription so that it doesn't matter where your eyes are, you're going to get the prescription that you're supposed to be in. Then when you want to read, you just switch to your reading glasses. That also should be a large frame so you have plenty of space for your eyes to wander but still be getting the right prescription. And then we'll also tell people if you use a finger or use a ruler with reading, that can help if you have attentional problems. It's easier to look at your own finger or right near your own finger than to keep your space on a page if you're having one of these issues. And then also, it is still important to get good regular eye examinations because like we talked about, as you age, there's a lot of other things that can be going on in your vision. And if someone's having visual problems from their brain, we just want to make sure that everything else that can be affecting their vision is treated so they have the best vision that they possibly can have. So in terms of caring for your eyes at any age, it's important to be aware of exactly what normal changes are and what to expect, and that's the presbyopia, cataracts, and dry eyes. And be aware that these are all things that we can improve with the reading glasses for presbyopia, surgery for cataracts, and with all the management we can do for dry eyes. And also keep seeing your eye doctor as you age, because your eyes are always changing and it's just important to keep monitoring them. And then it's also just important to know if you have family members or know people with Alzheimer's disease or other brain diseases that their vision might be affected by their brain disease instead of their eyes. And basically they should also be following with their eye doctor so that we can address any other problems that they're having and make sure that they're getting the best vision they can, even with those visual processing problems. So here are some other resources that you can check out if you're interested in more.
As you're passing your questions up, I think one of the questions is how often should somebody over the age of 65 get an eye exam, and what's involved in all of that?
Yeah, so
Optometrist versus an optician versus an ophthalmologist.
well, an optician is actually someone who just prescribes glasses. So you should be seeing at least an optometrist or an ophthalmologist. An optometrist is someone who did not go to medical school. They went to school specifically just for eyes. And so if you have just regular eye issues, an optometrist is perfectly fine to follow with. And then if you have anything that they get more concerned about, they can send you to an ophthalmologist. If you have healthy eyes and no other problems, then usually annually is perfectly fine for following up. Okay. Oh, if you have diabetes, then you should be following with an ophthalmologist. And often, if you have any problems in the retina from diabetes, then you want to be following with a retina specialist. All right. What is the most effective replacement lens for a person with cataracts? This is something that varies from person to person. There's so many amazing lenses out there for all kinds of different things, depending on whether you have astigmatism or depending on what prescription you have. So this is just something that you should talk over with your cataract surgeon about what your goals are for what your vision's going to be and what other eye problems that you have. Okay. Does a person with Alzheimer's disease have a narrower field of vision? And is that why they often knock over a glass in front of them on a table? So actually, if Alzheimer's disease is causing somebody to knock things over in front of them, it's not a problem with their visual field. It's a problem partly with the attention and also with the part of the brain that's getting the visual information talking to the part of the brain that controls where their hand is. So this is something that we call optic ataxia, meaning that you can't coordinate between the vision that you're seeing and where to put your hand in space. Are floaters a normal part of aging eyes? So sort of. So floaters are usually caused by a problem with the vitreous, which is the jelly-like part of the eye, kind of pulling away from the very back of the eye. We call that a vitreous detachment. And it's not necessarily normal, but it's extraordinarily common. And one thing is you should follow with your eye doctor on that, because if you have vitreous detachments, you can be at slightly higher risk of retinal detachments. But doesn't mean that you'll have them, but it's just important to follow with your eye doctor. All right. How can you prevent glaucoma? So glaucoma is often related to your family history is something that makes you a lot more at risk for glaucoma. So especially if you have a family history of glaucoma, you should follow with your eye doctor, and if you start to show signs of glaucoma, then they can treat you with drops, because glaucoma is is a disease in which the pressure inside the eye is too high, and that can hurt the optic nerve over time. So it's important to be treated with drops to keep the eye pressure down to protect the optic nerve.
This also has to do with wearing dark sunglasses and driving. Is that better?
So do the dark untinted sunglasses help with night driving? What helps with night driving? So if you're talking about having glare, then the dark glasses aren't necessarily going to help with the glare all that much. If you're having a lot of glare, then that might be something to just talk to your eye doctor about, whether there's something they would recommend you doing to help with that, depending on why the glare is happening. Should cataract surgery be done on both eyes at the same time if only one is bad? So it depends on what the eyes look like, because the cataract surgeons are going to look at how dense the cataract is. Most people who have cataracts have them on both eyes, but not always. So usually first of all, they'll never do them on the same day, for example, because they don't want to leave you with both eyes covered and both eyes having just had surgery. But this is just a decision. It depends on exactly what your eyes look like, and you should discuss it with your cataract surgeon. And how severe should your cataract be before you get surgery? So this varies from person to person depending on what your eye history is. Basically, most people would recommend that you wait until your cataract is severe enough that you want to undergo the risk of the surgery. It's a really safe surgery that people have really optimized at this point, but it's still a surgery and there's still risks to it. So you want to make sure that the benefit you're going to be getting is worth the risk of doing a surgery. Okay. I don't necessarily know. All right. I can't read that.
Can the tear film ever go bad?
Can the tear film ever go bad? Yeah, I mean, this is essentially what dry eyes is like, and if it's really, so the tear film just refers to the three components of tears that are kind of mixing on your eye, the mucus and the oil and the water component. So your tear film can go bad, and it also can fluctuate throughout the day, which is why a lot of people with dry eye may notice blurry vision that gets better and better and worse again. And yes, it can definitely make you feel like you have water in the front of your eye, because if you're having, for example, if your problem is that your oil part of your tears isn't as good, your water part might overproduce trying to make up for it, and then you can feel like your eyes are really watery and dry at the same time.
Last one, supplements for vision, carrots, fish oil.
Yeah, so the fish oil, it just depends on whether it helps you. It's not for dry eye, it's not necessarily preventing anything. It's if you notice that it helps with your dry eye. But there's plenty of other reasons that you may be taking fish oil other than that for preventative reasons. And yeah, if you're taking calcium supplements, that's great, but that's something dose-wise you should talk to your doctor about, depending on what you're taking it for. Okay. All right, thank you.
Thank you, Dr. Stunkel.